So there's been a little bit of confusion on everybody's part, including myself. We've been telling everybody to switch out to these radiolucent pads. All the STEMIs are supposed to be switched out to these, and we're actually moving away from that because recently a lot of the nighttime crews have been putting these pads on, and they take the patient up to the cath lab and they just rip the pads off, and they're ruining a perfectly good set of pads, and they're throwing their pads on. So we're actually moving away from using these in the department. Just keep your normal EMS pads on. If you're going to go up with EMS, of course we want to keep their pads on so we can shock the patient in the elevator. If the patient is our patient, we would put our pads on until we get the patient stable or we get Ross, and then we will continue to use our pads upstairs until we get to the cath lab. So just to reiterate, we do not have to put these radiolucent pads on. The patient does have to go upstairs with a set of pads on. So I don't care which ones you decide to use. If these are the quickest ones to grab, you can grab these. You can still shock your patient. You just can't pace the patient. But I would just get in the hang of grabbing a set of pads, even if they're the CPR pads. Any questions, concerns, make sure you follow up with the education office, and we'll keep you guys up to date.